the way the government wants you to be insured. The exchange is going to be the police force. It's the one who's going to report to the IRS whether you're insured. And then if you're insured, whether you're insured the way the government wants you to be insured. So it's so important that you are here today. And what right now I'm going to bring up, because I know their time is limited, I am going to bring up one of the key legislators. He has authored the bill for prohibiting the health insurance exchange in this state. So please give a warm welcome to Representative Doug Wardlow.
Let's show Doug how we can chant. Want real hope? Want real change? All right, Representative Doug Wardlow, it's all yours.
Okay. Hi, ladies and gentlemen. Thanks for coming. See, you're all fired up. It's very good. These healthcare exchanges that are part of Obamacare. Well, first of all, as you know, Obamacare is the greatest threat to our constitutional system and to liberty in our country that we have faced in decades. It's the culmination of a road that's pretty long, 80 years plus long, since the New Deal at least, heading towards a constitutional cliff where the federal government continues to absorb powers and state sovereignty shrinks commensurately. And that's why we have to stop this, because this is the straw, or perhaps the bunch of bricks that will break the camel's back if we don't stop this here. And exchanges are absolutely critical to Obamacare's regime and the plan to basically turn healthcare in this nation into a single-payer system where the federal government has control of what kind of healthcare you may purchase and what kind of health insurance you may purchase and the doctors you can see. And if they can take that liberty away from us and take that sovereignty away from the states to regulate that, then the federal government knows no bounds, and the Constitution and the enumerated powers of the Constitution have no real limits. They would be eviscerated. So it's absolutely critical that every state, including Minnesota, stand up against the exchanges. The exchanges under Obamacare are merely a means to co-opt states into supporting Obamacare, getting into it voluntarily, buying into the plan, so that opposition dies down, and eventually, if there's too much co-opting of states and corporations, and think of all the waivers that have been given under Obamacare. If that happens too much, Obamacare will be unstoppable. So this is a very well-crafted plan by the President and by the administration to basically eviscerate constitutional protections that protect our individual liberties, going far beyond healthcare freedom to our economic liberty and liberty in general. So we need to stand up against the exchanges. The exchanges, this is how the exchanges will work. The healthcare exchanges will be, the states are tempted basically by the law, by the Patient Protection and Affordable Care Act, to opt into the exchange, to build their own exchange, because there are certain things that will happen under the law if you don't. Supporters of the exchanges are motivated by fear. They think that if the state creates an exchange, if the state sets up its own exchange, then we will have nothing to fear because we'll have control over it. But that is an illusion, that is a fantasy, that is a chimera, and we need to stop this now, because all we will do if we buy into the program is allow federal regulation of the state exchange eventually to control our healthcare decisions in Minnesota. And if we believe in the Constitution, if we believe in individual rights, liberty, the pursuit of happiness, if we want to protect those things, we need to draw a line in the sand right here and say no to these exchanges right now. And there are members in both parties here at the Capitol that don't quite understand this. And we have legitimate policy debates about whether these exchanges are good or not good. But the fact of the matter is we need to educate and make people understand, get people to understand how these are such a fundamental threat to our liberty, because we are on the brink of a constitutional catastrophe. And these are just one more way for the Obama administration to buy off opposition and to create a central government that has all authority to the detriment of the states and the people. So thank you all so much for coming.
I want to take this opportunity to thank Twyla and the Citizens Council on Health Freedom for the great job they've done this year educating all of us as to what's in that 3,000 page bill with I don't know how many sections. I like to call that bill our Freedom is Gone Act. So I want to ask you all, why would we assist the federal government in implementing an exchange that would lead Minnesota to a single-payer health system? Instead, I say we fight these health insurance exchanges tooth and nail. I also want to ask you, why would coerce us into doing? If it's such a great idea, why doesn't the market just do it? And that's my question, and nobody's been able to answer it yet. Why do we want to give the federal government a tool to meddle in every part of our lives? I don't know if you all know, but I'm also a registered nurse. And if you don't think that this bill, and I know you all know this because you're very well educated, if you don't think this bill won't affect every part of our lives, then I got a bridge to sell you. I found some quotes from one of our favorite commentators, Mark Stein, in the Imprimis, April 2009 edition, and I need to have my notes here to read this because I want to quote him correctly. And in his speech he said, forget the money, forget the deficit, the debt, the big numbers with the 12 zeros on the end of them. So-called fiscal conservatives often miss the point. The problem isn't the cost. The problem with these programs would still be wrong even if Bill Gates wrote a check to cover them each month. They're wrong because they deform the relationship between the citizen and the state. Even if there are no fiscal consequences, the moral and even spiritual consequences would still be fatal. Later, once we allow socialized medicine into our country, into our state, it can be used to justify almost any restraint of freedom.
And from the Galen Institute, a good friend of mine, Grace Marie Turner. Thank you for being here.
With you, John. Thank
what
you
exactly is the Galen Institute?
We're a think tank like the Independence Institute, but we focus just on health policy and particularly free market ideas based in Alexandria, Virginia, right across the river from Washington, D.C.
And just so people know where you stand, I wonder how that is, why Obamacare is wrong for America.
In case there's any equivocation.
In case you were wondering.
Right. But the administration is full bore, moving ahead to put this law into place.
What does that mean? I mean, a lot of us didn't even know what's in that law, and I think a lot of people who voted for it didn't know, because a lot of it is happening by regulation. So in other words, it created more committees and regulatory agencies. They're going to make the rules by which we live, so we really don't even know what it looks like. Am I on target?
You are, because even though it's 2,800 pages of legislation, there are at least 2,000 references to the Secretary the Secretary of Health and Human Services has enormous power over this 1/6 of our economy, a $2.5 trillion economy, to really try to run it from Washington.
And where are we?
Well, what people don't usually understand is that there's a tremendous amount of money in the bill to bribe various entities that would normally be against it. So states get a tremendous amount of money to set up state exchanges, and states get a lot of money to set up new ways to share your medical records with everybody but your doctor. And the other thing that's going on is hospitals are getting a tremendous amount of money from this. So in addition to...
When you say that they're getting a lot of money, I mean, how are they getting money?
There are grants in the bill. They're called planning grants or whatever. You get so many $1 million if you do this. You get so many $1 million if you do that.
So if your state puts together a healthcare exchange, we're going to give you X amount of money. If you put together some sort of system for all the medical records to be centralized in a database, we'll give you some more money. In fact,
we have an all-payer database here that's been authorized, and you won't be able to stay out of it. Your doctor will be fined if he doesn't send all of your medical records to it, and it's going to be shared with some regional organization that doesn't have to follow HIPAA privacy requirements.
So in other words,
the way this works is $500 billion in cuts from Medicare, $500 billion in new taxes to pay for this massive expansion of coverage, 32 million more people, without doing anything to reform the programs, to reform the infrastructure that has caused prices to be so high, unrealistically high in the health sector.
See if I can put it in.
But in Massachusetts, costs have gone up. Waiting lines
care has gotten worse, and the lines have gotten longer.
They're about 100-day wait for a primary care physician appointment because they did nothing to increase the number of doctors. They increased the demand without increasing the potential for supply.
See, Grace Marie is so kind. I think it's because they totally misanalyzed the problem. And the problem is not that people don't get enough care or that people don't have access to care. The problem is that we have third-party payers and that too many people are spending other people's money on health care. And what Obamacare does is everybody's spending other people's money on health care. The problem is, though, that then you can use these companies for whatever political end you wish, like Xcel Energy here in Colorado is charging very high rates, keeps going up, because the state thinks they should do more green energy, so ratepayers have to pay for windmills that don't work and whatever. Denver Water gets to raise rates because it didn't put enough money away to repair its pipes and people conserved too much water, so it raised its rates. This is what public utilities do. If you start thinking about the fraction of your budget that health care is, this is a very dangerous position to be in, because basically it lets the government say, hand over whatever I tell you to hand over, or you don't get health care. Somebody dies.
Well, Congresswoman Bachmann.
Thank you. Thank you, Senator Limmer, and thank you all for coming this morning. There's an old phrase that says, when you're in a deep financial hole, stop digging. And as you know, Minnesota is in a $6 billion financial hole right now. And unfortunately, our new governor, Mark Dayton, who is a good man, he is not we're not here to say that he's a bad individual. We just simply think that he's wrong about his prescription for where Minnesota needs to go. Made a statement that I thought was fairly remarkable last week. He made a statement in the paper by saying, repeal of Obamacare would be catastrophic for the citizens of our state. He went on to say that he is seeking to expand Medicaid for an additional 95,000 Minnesotans and extend the deadline to apply for a $1 million health exchange grant, which our Health and Human Services Secretary suggested is in the works.
And where are we?
Well, what people don't usually understand is that there's a tremendous amount of money in the bill to bribe various entities that would normally be against it. So states get a tremendous amount of money to set up state exchanges. And state...
Good morning. I'm Ted Lilly, Senator from Senate District 56. And quality health care, world-class health care that we have had in Minnesota comes best when you have a relationship with your care provider directly. It's between the patient and the care provider. And when government steps in between and puts roadblocks between that process, the quality of health care can be reduced and impacted. Many employers across the state and across the country have already had to give out notices to their employees that health care has been changed. If we have health savings plans in January, we had to send in a note to our employees that we are rationing health care, that we are cutting back on what is available to them as far as coverage. So some of the things that have been covered by health savings plans in the past are no longer covered. And those are the types of things that employees and that constituents are concerned about in this new health program. So we need to be careful what we are doing, and I support Senator Limmer and Congresswoman Bachmann in this effort. Thank you.
I just want to add one more thing. With Obamacare, it's becoming more and more clear what we bought in this health care overhaul is one of the largest bureaucracies America will ever see. We have a chart that is, I apologize for how small the font is. It almost looks like the font in the tax code. But if you look at this healthcare chart, there are 1,950 new regulations that will have to be written under Obamacare. Now, if you consider 32 million new people will go into the healthcare system, but no new doctors, no new nurses, and only the financial resources that we already have. So what this means is we'll have to be spending trillions of dollars more for this system, but what we're really getting is not more health care, we're getting one of the largest bureaucracies that we will ever see in the United States. That's what we're buying in all of this. It will mean more hassle, more expense, but not necessarily more or better quality health care.
Question, Representative.
Well, without further ado, I'd like to present Twyla Brace.
So nice of you all to be here and to invite me. I thought what I would do is make sure that you all knew about the health insurance exchange, and just so that you know, our organization is called Citizens Council for Health Freedom. And we've been around since 1995 and had this name. Now we just changed it new in October. And have been working to support patient and doctor freedom, medical innovation, and the right of citizens to a confidential patient-doctor relationship. particularly because we believe he who controls the data makes the rules. And so it's really important that you're able to control your own data. The biggest thing, I think, the biggest success that I think that we had here in this legislative session was to stop the Obamacare health insurance exchange. And I wanted to make sure that you all knew what the exchange is, what it does, why you shouldn't like it. And then I'm going to talk to you about some troublesome facts about Obamacare and say a few things about Minnesota and what's been happening here. But what you need to understand is that the exchange is not a marketplace. It's not a one-stop shop to purchase health insurance. It is, as someone said to me, it's a lobster trap. It's a place, if you know what a lobster trap is, the lobsters crawl up, go into it, and they never get out of it. And that's how you need to think about the exchange. Once you are in the exchange and buying insurance in the exchange, you will be stuck there. The exchange will grow. The exchange we consider the command and control center for Obamacare installed in every state. And so this legislative session, Representative Gottwald, a Republican, had a bill to establish the exchange. There were also Democrats that had bills. Thanks to the efforts of citizens working with our organization, we managed to stop the exchange. We stopped all the hearings. The day that the hearing was supposed to take place, we had 70 people come. And Representative Gottwald moved his hearing to the evening and then just didn't have the evening meeting. So that was the only exchange hearing that was actually scheduled. The Senator Hand never scheduled a meeting, never had a bill in the Senate. In the House, there were at least 2 attempts to put it on as an amendment to another bill, and thanks to citizens, we were also able to, at the very last minute, having learned about that, able to get a bunch of citizens to send in letters to the members of that committee, and we stopped that attempt, which was actually, I believe, an attempt by Representative Greg Davids out of Preston, a Republican out of Preston, who argued strongly for the exchange being put on the bill. Even though it was a Democrat amendment, it was the Republican who was arguing for it to be put on the bill. So, and then at the during the special session, although none of the bills that went to the governor's office had any kind of exchange in them, the bill that was introduced for the special session, it came out at about 10 p.m. I looked at it, and about 10:05, I saw the health insurance exchange in the bill. And I contacted members of the Senate and of the House and said, the exchange is in the bill. This is an Obamacare bill. What are you going to do? And they decided to take the language out of the bill. Oh, actually, what they decided to do, because there's no amendments on the floor during special session, is they simply introduced a brand new bill. So it had been House File 25, special session House File 25, and it became special session House File 25, which was just, did I say 24? It was 24, became 25. It was all the same language minus that one sentence. And that one sentence, even though a lot of people said, well, we don't know for sure that they could have looked at it and considered it to be authorizing language, I believe that the governor's office would have used it to say, well, here it is, these words in the bill, people are supposed to be put into it as authorized by a certain statute. The statute doesn't exist. It's where it was supposed to be. So there's like this little sentence in there. I think it would have been enough for the governor to argue that he had statutory authority to start the exchange. All of that said, I have heard that his plan is to do the exchange without legislative authority. So whether he does it by executive order or something else, that's what we're watching for. And I'm pretty sure that he's en route to doing it, and I'm just looking for the documents to prove it, that it would actually be put into place. And that will be a whole nother battle. But the good news is that we managed to stop it from becoming legislation, even though the Republicans really wanted it. And we're really convinced by this idea that it's a marketplace. You know, the interesting thing about the argument that it's a marketplace is that there's a 2-pager that came from, you know, one of these organizations that do surveys and studies and and focus groups and try and figure out what's the best words used to sell something. So there's a group, Hernan or something like that, associates, who did this kind of a survey and focus groups, and they found that the very best word that works for non-government type folks, non-big government type folks, for Tea Party folks, is to say marketplace. And if you say marketplace, they will buy it. So the Republicans and the Democrats, everyone at the legislature kept saying marketplace. And it's not a marketplace. And as a matter of fact, the federal government came out with their first set of regulations for the exchange. 347 pages long. It mentions the word require 811 times. Now, the arguments at the legislature were that the state would have flexibility and this wouldn't have to follow the federal government. But the fact of the matter is there's only one exchange. It's called the American Health Benefits Exchange, and that's the name of it in Obamacare. That's the one that all the rules are coming out of, and that's the one that they would have had to follow. Every exchange in the 50 states would have to follow those regs. Those are not the last regulations. These are proposed regulations. They said that there are subjects included in the Affordable Care Act to be addressed in separate rulemaking, include but are not limited to standards for individual eligibility for participation in the exchange, advance payments of the premium tax credit, cost-sharing reductions, and related health programs, and appeals of eligibility determinations. That's number one. Number two, standards outlining the exchange process for issuing certificates of exemption from the individual responsibility requirement and payment under a certain section. Number three, defining essential health benefits, actuarial value, and other benefit design standards. And number four, standards for exchanges and qualified health plan issuers related to quality. So we have 347 pages of regulations already. And there are all these other things that they plan to issue regulations on. So, what we're talking about probably is at least 1,000 pages of regulations that every state will have to follow, which is why we call it the Command and Control Center of Obamacare, installed in every state, and which is why we fought so hard to stop that here in the state, despite the fact that Republicans were pushing it. So the next thing I'd like to move to is some of the troubling things about Obamacare. In case you haven't heard them, I think they're really key things for you to understand as to why Obamacare is essentially in trouble, despite the fact that 15 months ago it was signed into law. It's never quite quit. It's never over. I think the president thought it was going to be over. Let's just get this thing signed and we will go on to other things. But that hasn't happened. So here's a few things. I don't know if you know that there is a pre-existing condition insurance plan that was part of Obamacare. And they projected that 375,000 people would enter and would quickly use up the $5 billion appropriated for this program. Well, to date, 12,000 people have enrolled. 12,000 people. So as Cato says, this suggests that it wasn't necessary to conscript 200 million Americans into a compulsory health insurance scheme to solve the problem. I suggest Cato is correct. Okay, another problem is this idea of the secretary being able to decide what kind of coverage we all must have. Some of you may have seen that the Institute of Medicine, the IOM, recently came out and recommended that conception coverage should be part of the essential benefits set. That should be part of every health insurance plan. That should be something that all of us have to pay for. And all the news reports, or lots of the news reports that came out afterwards, said that the IOM supports free birth control. Well, as you probably understand, there's nothing free about a required benefit. It means that all of us would have to pay for this service, whether it violated our conscience, whether we didn't need it, whatever the reasons are. The whole thing of calling something free just tries to move the American public in a way of thinking that is totally erroneous. These higher costs, these free services, of course, will lead to higher utilization of services, which means that it will lead to higher premiums for all of us. Because obviously, whatever you pay for, the more you get of that particular thing that you pay for. Before Obamacare passed into law, the Congressional Budget Office, which is, the big federal budget office, said that they expected richer benefit set that would be issued by the Secretary of Health and Human Services would raise individual insurance premiums by up to 30%. 30%, just from raising them. And that doesn't count the increased utilization that will come as a result of offering more services. So that means it will go even higher than 30%. And another thing is those jobs. Remember all those jobs that were supposed to come out of Obamacare? As a matter of fact, Pelosi said that 4 million new jobs we would get out of Obamacare, and 400,000 of them would come almost immediately. Well, the Congressional Budget Office expects 800,000 jobs to be lost. The Heritage Foundation has a new study that shows private sector firms created more than 67,000 jobs before Obamacare was signed into law. 67,000 jobs per month, okay, prior to the enactment. But after April of 2010, so after it was signed into law, private sector job creation plummeted to only 6,400 jobs. So it's only now creating a tenth of the jobs that were created prior to Obamacare coming into play. And the co-founder of Home Depot, Bernie Marcus, underscored what I heard probably about a year and a half ago, that the National Governors Association had been talking. And they said that they thought Obamacare would lead to 150,000 pages of regulations. Actually, I correct that. I think that I heard that it was going to lead to 250,000. Whatever. What he said was just Obamacare by itself, you have a 2,000-page bill that's probably going to end up being 150,000 pages of regulations. So far, there are 8,700 pages of regulations for this 2,700-page bill. According to the judge, it's a 2,700-page bill, and to Judge Vinson, so I think that's the one that you just keep in mind. It's a 2,700-page bill. No matter what anybody else says, we're just kind of sticking to that number because that's what the judge called it. So far, 8,700 pages. Now, the thing you have to realize about regulations, 8,700 pages, is that essentially what we have here is 4 times the amount of pages that Congress put into place. So Congress voted on 2,700 pages. But there's 8,700 new pages of law, which is what regulations become, that Congress never took a vote on. And there are hundreds or thousands, 150,000, 250,000 left to come. We don't have any idea. But the fact of the matter is they are unelected bureaucrats using the law to create regulations to which members of Congress have no say in. And if you look at sort of what has happened with the EPA and how members of Congress are writing letters against the EPA, what the EPA is doing, I mean, this is who's in charge here? Is Congress in charge or are the regulators in charge? Clearly, we have put this country into a place where the regulators are in charge and the Congress rubber stamps a lot, complains a lot, but really the big players in law are the regulators, are the government agencies. So here's another little troublesome fact. You remember how if you like your insurance, you will be able to keep it? That was what the president said.
Yep.
So if you like your insurance, what's turning out is that you will not be able to keep it. So a Gallup survey estimates that nearly 10 million adults have lost their employer-sponsored coverage since Obama was elected. And the McKinsey study said that 30% of employers are likely to drop their insurance once Obamacare takes full effect in 2014. So that means that those employers are going to send their employees over to the lobster trap, to the health insurance exchange. And there they will only have the limited options that are allowed, which are bronze, silver, gold, and platinum coverage. But they don't necessarily have all 4 of those plans. They only have whatever their employer says that they have. If the employer is going to pay for some coverage but just send them over there, the employer can dictate how much coverage or which choices that they can have within the lobster trap, within the exchange. Okay, let's see. And then let's look at the cost of that. So former CBO Director Dr. Holz-Eakin says that if half of all Americans end up in the exchange, the annual cost of Obama's subsidies would increase by $400 billion by 2021. Annual cost. So every year, $400 billion, $400 billion, $400 billion, right? Under the law, employees can receive a subsidy to buy health insurance. So here's another little troublesome fact, which has to do with employees and a promise or an assertion that was made about Obamacare. The assertion was that employees, if the employer's health plan costs the employee more than 9.5% of their income, then the employee could get subsidies. But as it turns out, the Congressional Budget Office scored the bill differently. They said, well, that means that if the employee looks at the employer's coverage and says that it doesn't cost more than 9.5%, fine, he could have, or no, if it does cost more, he could have subsidies. But if it costs 20 or 25% more because he's not just getting his own insurance, but going to get a family plan, too bad. No subsidies. So if it costs 20% more, 30% more, it doesn't matter. The only thing that matters is whether it costs for the employee to buy his own insurance, not for his family. So even the Democrats are complaining now that they figured this out and saying, we got to make this affordable or we're going to have all these people complaining, right? So this is another one of those things where we have to pass the bill so we can find out what's in it, right? Okay, and then the perhaps you've heard that Obamacare disregards Social Security checks, and this means that a whole lot of millions of people are now eligible or will be eligible for Medicaid, even though they can make lots of money or enough money through their Social Security program. And then finally, 3.2 million people have a waiver from the compliance requirements. Do you have a waiver? Any of you have a waiver? Okay, 1.58 million of them are union-affiliated plans. Wow. So there is a bill in Congress now, I believe it is Congressman Burgess, who would essentially allow every American to get a waiver from Obamacare. And you gotta like that. I think everybody should contact Representative Burgess and say, like your plan, go for it. Okay, so now I'm going to make just a few comments about there's lots of other things a person could say about Obamacare, but these were some of the critical ones that I think just shoot holes in what Obamacare was said to be and what it is turning out to be. Two very different things. Before I go, I want to just give you a few comments about what happened at the Minnesota legislature this session, some of the things that are in the bill. How many of you are on our email list? Okay, who of you remember seeing the email I sent out the night special session was over? Okay, so I just got a feel here of who might know a little bit of what's in this bill, but I know I didn't include one of these things. So I'll just go quickly over this. A really concerning thing for us is the whole move on health disparities, racial and ethnic and sexual preference profiling. And there is all session long, we work to keep out the words racial and ethnic disparities. And Abler had put them in. Representative Jim Abler had put them in. And we told them it was evil. And we told the speaker it's evil. And we got them all out in a conference committee hearing. It was the first thing. Kiffmeyer had the amendment, and we took them all out. But they kept in $1 million for reducing infant mortality that had been attached to that racial and ethnic language, but they took that out. And I said, we need to take that out because that's just going to be used as a little slush fund, $1 million a year to do the race and ethnicity stuff. And Han, good at that he was, he had zeroed out all health disparities, this is what this is called, all health disparities funding. He zeroed it out completely in the budget. But there was this $1 million left, and I said, you got to get that $1 million out, or that's going to be what will keep them afloat until when you're not in power. And we didn't get it out. And then, of all things, it comes back in the special session bill as $2 million per year for reducing racial and ethnic disparities in infant mortality. So we have a law in the state in 2005 by Representative Goodnow, a Republican, to essentially stop or to reduce health disparities across a variety of conditions. Depression, I think obesity, cardio conditions like stroke, and there's like 5 conditions. So we tried to fight against it back in 2005 unsuccessfully, and so they've created a lot of databases that have your race and your ethnicity and all sorts of things. And the press is on now to collect all this information at your clinic and to ask you to divulge your gender, your sexual preference, all this stuff. At the federal level, HHS just came out with a proposal to collect all this information, and so they could do research. That would mean every doctor's office, every clinic, every hospital would ask you every time you come in, what race are you? What ethnicity are you? What gender are you? What sex are you? What language are you? And what's your sexual preference? August 1st is the deadline at the federal level to make comments on this. And if you put your name on our list, you'll get a notice, because tomorrow I'm writing our comment on it, and then I'll send it out to everybody on the list and give you the opportunity to tell the federal government what you think about this idea. But what you do need to know is, in law, in Minnesota, $4 million to try to reduce racial and ethnic disparities, and this will be used to push whatever HHS comes out with, including sexual preferences. The other thing I wanted you to know was there's Alzheimer's surveillance, and there's a push to check every person for their cognitive ability and track them according to this. There is environmental health tracking, which means that they've been given $536,000 over the course of 2 years to combine all the databases in the state government to push environmental policies according to what they come up with as the health impacts of environmental issues. So PCA can combine with the Minnesota Health Department, can combine with the Department of Human Services, can come up with all this information and push policy, say that our health is being harmed, and then push policies to stop our health from being harmed, and essentially greening policies, right? So environmentalist policies that will control different facets of your life. So we were not happy to see that in the environmental bill. The Freedom of Choice in Healthcare Act did not pass. I have assurances that it will come as a constitutional amendment next year to be voted on by the public. And there were attempts to try and get a prohibit the lobster trap health insurance exchange. Senator Gretchen Hoffman and Representative Doug Wardlow were the authors. We have a picture of them with all, if you signed a petition, with all the petitions that you signed, but we couldn't get it in the bill, and the governor absolutely refused to put such a thing in the bill because, of course, he wants to do it on his own. So I encourage you there to be involved, to get on our email list, because right now the public comments are on health disparities at the federal level. At the federal level, also accounting of disclosures, which will limit your access to who has accessed your medical records. Limit your ability to know who has accessed your medical records. The federal government is asking for, how do you define patient-centered outcomes research? And this is what will be used as part of the death panel, as it were, to recommend to the Department of Health and Human Services what kind of services should be covered for whom and who won't get them. So it'll be used to ration care. And then the health department is asking a question about their health information exchange and looking for public comment. And all these things I'll let you know about if you're on our email list. So thank you very much for your time. If you want to go to our website, it's www.cchfreedom.org, or if you can remember it better, www.healthcarefreedom.us, as in the United States. So thank you very much.
Thank you very much. Would it be all right for you to answer a few questions?
And I forgot to say, Here's our thing on the Obamacare and lots of the surveillance parts of Obamacare. A little information about our organization in case you want it. And of course, our baby DNA card. And Nature magazine actually featured our efforts in this month's issue. And the Supreme Court, the Minnesota Supreme Court decision will be out some Monday. We don't know which one yet. But feel free to take any of them and to share these baby DNA cards with anyone that you know that's pregnant. Okay, questions?
Now you mentioned it sounded like you were at least having issues with not only Democrats pushing some of these bills to the Republicans as well.
Correct.
Do you think is it because there's wording in the bill that would be advantageous for Republicans to vote for, or would it be because of confusion of the wording in the bill that they don't quite understand? There's not enough clarity in it, and they think it may be something different. I'm a little concerned that they'd want to push something like that through. To be honest with you.
With the health insurance exchange, the lobster trap, the reason I believe that was wanted was, number one, they were really bought and sold on the idea that if they created their own exchange, they could somehow stop from having to follow the federal one, the federal requirements. But that's just ridiculous, because every exchange, according to Obamacare, has to follow the federal law and the federal rule. We put out a paper on what the law actually said about the exchange, so people could actually see into the law with the sections and everything, so they could see into the law to say what it actually says. So I think they thought that if they created one on their own, they somehow would get outside the federal rules and regs, which is ludicrous. The other thing is the health plans were pushing it, the Chamber of Commerce was pushing it, and the health insurance agents were pushing it, thinking that they could save their jobs. So,
why are the health plans, the insurance plans, why are they pushing exchange?
Well, I think the chamber might be because the health plans are a really big player within the chamber. I think the health plans are pushing it because they look at it as a way to monopolize the market. They will be the only plans in. They'll be at the table deciding who gets to be selling health insurance in this state. That's part of what the exchange does. All players are not allowed to sell insurance, and
Sets up a cartel.
That's right. Sets up a cartel. What a lovely! You just remembered that. That is a perfect way to say it.
All these regulations, that's what they do.
Yeah.
They're supposed to regulate the industry, but what they do is, like the ICC in the late 19th century, the industry ends up running the agency, and it sets up a cartel, and it keeps the competitors out, so the existing players do very well.
Yeah, it's really a monopoly. You know, it just sets it up, and those existing players get to be on the table to just make all sorts of decisions while the rest of us are working. Yes.
Is the survey that you're supposed to fill out, is that mandatory, or are there any penalties?
And which survey would that be?
You were talking about the one we had to list.
Oh, race and ethnicity.
Race, and who determines who is what?
Yes. Well, see now, that's a really good question.
If I mark Asiatic.
Yes, I just...
There's a possibility.
No, it's true. And I just can't remember who came out recently with a survey, and they found a phenomenal amount of times where what was listed in the medical record is very different from how the patients self-classified themselves, right? So there's classification that's coming from the nurses and doctors, and they're putting it in the record without asking. And they're finding, when they actually ask some of these people, that they classify themselves differently. So at the federal level, they say this will be a self-reported, they'll do it self-reported. And so let's just say you're part Chinese and part Brazilian. You know, what will you be, and how will they classify that? They say it would be voluntary. I will bet more than anything that eventually it will get to the point that clinics and hospitals, part of what they are graded on for payment is the extent to which they get that information reported to the federal government. And the pressure is on for you to answer it, because lots of patients feel they're in a vulnerable spot. And it's like the nurse is sitting there saying, well, you know, we need answers, right?
Just out of curiosity, is there any national definition of what race is?
Well, that's another thing.
How is that determined?
There isn't, and it's a social construct, right? So you can't, you know, it's sort of like what I remember reading about this new study, is that a certain percent that were classified as black, they actually called themselves white. And if you recall correctly, well, not all of us, but some people waited sort of with bated breath to see what President Obama was going to put on his census. Well, he put black.
Yeah.
But he didn't have to, right?
He could have done white.
He could have done white. So the really important thing for you to understand about the whole health disparities is in 1999, there were 2 dissenters to a report that came out of the U.S. Commission on Civil Rights. And those dissenters said that they saw the whole health disparities thing as a thinly veiled attempt at pushing and advancing national health care under health equality, right? So,
where does the governor stand on all this? What's his agenda? What is he trying to accomplish? Can you kind of summarize where he's going?
Well, I don't know the governor well. Wondering where the governor is going, I think, is just whatever the governor wants, he would like to get. But I don't know the governor well. It's not totally clear to me what his agenda is. He obviously likes big social programs.
Did he favor the exchange? Does he?
Oh yeah, he favors the exchange. He wants the exchange.
I know he was a big fan of the Medicaid opt-in.
Yep. So, you know, for him, he would be supporting Obama's program. So he wants exchange, he wants more people in Medicaid, he wants higher taxes, like Obama wants. Yeah.
It seems to me on this exchange business that the only way it works is if you commoditize healthcare. That's what you do when you have wheat, gold, oil, whatever. Do we really want commoditized healthcare? Is that a good thing?
Well, I don't know that, and I'm not totally sure exactly how you're seeing that, but the fact of the matter is the exchange works like this. The government and a panel that's a public-private panel within the state decides what kind of which health insurance companies will get to play. So whoever gets to play then has to offer the bronze, silver, gold, and platinum plans, which are all detailed in Obamacare.
That's commoditization. That's how you standardize the contracts, like you would for a wheat contract or the commodities deal.
Right. So they all have to offer the same thing, and then you may or may not get to pick all of them. And I was in Washington D.C. about 10 days ago, and listening to a presentation on health insurance exchanges in combination with health information exchanges. So one of them is the whole move here to put all of our health information online. The other one here is the lobster trap, right? And so there was someone from the Department of Health and Human Services who said the exchange offers the opportunity for everyone to have the same kind of coverage as Congress. And I got up during the Q&A and I knew where this was on my BlackBerry, and I pulled it up and I read to her and the entire audience how what she was saying was false, and how the New York Times had said it was false, and that the secretary or the staff themselves admitted that this wasn't actually true, that an employer could tell you, well, you can only choose from the bronze coverage options. You don't get all the way from bronze to gold. And how much do you want to bet that Congress will have all the options, right? So anyway, that was kind of fun to point out that her own department had said that was wrong, but she was still spouting it off to our audience. Yes.
Democratic Congresswoman Betty McCollum has said numerous times in town hall meetings and such that she has the same health coverage that the rest of us do. What differences do you know of between what she has and the common Minnesotan?
Well, currently I believe they have a choice of around 300 plans. So they will get to choose, and I don't exactly know how that choice works, but it's a very high level of plans. At the end of the day, though, when Obamacare is fully implemented, there will only be a limited option of plans because only so many of them are going to survive this system. So that will be extremely cut down, but I would bet that they will have the breadth of all the plans possible that remain.
So once we go down this rat hole or Obamacare experiment, is there any way back out of the rabbit trap or rabbit hole?
I believe there's always a way out. It's a matter of how far down we go and how long it takes us to get back out. So Medicare is creating a crisis that could be beneficial for depending on what direction you go. So if you go further down into bringing everybody into government health care in order to solve the Medicare problem, which just means that everybody pays eventually into the same pot in some form or fashion, single payer or maybe 5-payer, but they're all sort of blended together, you know, sort of like Germany. Germany has like 200 and some plans, but they're all the same thing, right? You know, you get to choose, but it's all the same thing, right? So part of the Medicare problem, which means that it's going to be bankrupt in by 2024, is that the tendency here is to try to bring everybody's money together to solve this so that it's not a huge political problem as we move forward. But if you can actually make Medicare, if you can actually break Medicare out of a government-run system, it is one of the ways that we could help keep everybody out of a government-run system. I also believe that the Supreme Court might have an opportunity to, if they say no to the insurance mandate, that just blows a hole in all of Obamacare. But I think there are other lawsuits that could follow. A lawsuit on the exchange, a lawsuit on the fact, I want people who are going to lose their individual coverage to sue. So Obamacare outlaws individual, real catastrophic coverage as of 2014. So if you have a true insurance policy, not a prepaid HMO or health plan kind of policy, and you have high deductible, really high deductible, you cannot have your plan. I think this is a harm. You have paid all this money in all these years, and suddenly it is taken away from you, and all your investment is gone. And so, you know, I think there are different ways, and I totally believe that the pressure has to keep on. And there might be ways that we haven't even thought of yet.
So, Twyla, we have the health care mandate has to go into effect federally by 2014. Every state has to pass an individual mandate called the health care exchange by 2014 that mimics or replicates the federal exchange, correct?
Well, it's more like every state has to do it, or the Obama administration has threatened that they will do it. Of course, they don't want to do it. The threat is all about getting the states to do it. So they don't have to, and so they have the exchange installed in the state.
Now my understanding is there's some states that are either A, exempt, or have fought it, found it unconstitutional, and are continuing to fight it. Can you fill us in a little bit on that?
Nobody's exempt.
Okay.
But there are states that have sent the money back. There are states that have said no. There are exchange bills that have been vetoed by the governors. There are bills that were killed in committee in different states. I believe there's about 12 that have said no in one way or the other. So that's another thing, is that states can just rise up and say, no, we've just remembered our 10th Amendment rights. And we're just going to say no and see what you do. And so hopefully there's at least a few leaders who will do that to stop this, to protect their own people. You know.
With us on anything, but they have taken the position, apparently, by this action this last week, that they are going to unilaterally do this. And we believe that they do not have the authority to do so, and we're going to pursue every means available to us as a legislature to prevent that from occurring. They should not be taking Minnesota down the path to enacting this law in the way that they're doing it without the counsel of the legislature, without the input of the stakeholders in the healthcare community. So
we have grave concerns over Governor Dayton's willingness to fully embrace the federal Obamacare. We believe we would be better served, Minnesota would be better served if instead the governor was a partner of ours in resisting the federal takeover of health care. In Minnesota, we have a long tradition of doing things right when it comes to health care. We've been a leader nationally, and yet now it appears as though the governor is interested in throwing all of that under the bus because he has a willing partner in the White House, in President Obama and his administration, and that now they can get together and impose this on the citizens of Minnesota. And the real losers in this are going to be Minnesotans.
I'm bouncing light from somewhere else onto my subject, which is